Salt is one of the most misunderstood and underestimated dangers in modern diets, especially for heart patients, and what makes it truly dangerous is not the salt you consciously add at the dining table, but the vast amount of hidden sodium quietly present in foods that are marketed as healthy, low-fat, diet, whole grain, or even doctor-recommended, and as a cardiologist, I repeatedly see patients who are shocked when their blood pressure stays high, their leg swelling worsens, or their heart failure symptoms flare up despite believing they are eating correctly, because excess salt causes the body to retain water, increasing blood volume and forcing the heart to pump harder with every beat, which raises blood pressure, strains weakened heart muscle, worsens breathlessness, and increases the risk of arrhythmias, stroke, kidney damage, and hospitalization, particularly after bypass surgery, valve replacement, or in patients with reduced heart function, and the most deceptive sources of sodium include packaged breads, breakfast cereals, soups, sauces, salad dressings, pickles, pap ads, ready-to-eat meals, processed cheeses, bakery items, flavored yogurts, instant oats, and even foods labeled low-fat because when fat is removed, salt is often added to maintain taste. And this constant low-level sodium overload keeps the body in a state of fluid retention and vascular stress without producing obvious immediate symptoms, which is why many people do not connect their swelling, fatigue, or rising blood pressure to diet, and for heart patients, the recommended sodium intake is generally less than 2 grams per day, and often even lower, yet a single packet of soup, sauce, or snack can contain more than half of this limit, making it essential to learn how to read food labels carefully by checking sodium per serving and understanding that low sodium, reduced sodium, and no added salt do not always mean safe, because even reduced sodium products may still be dangerously high for cardiac patients, and beyond blood pressure, excess salt directly damages the lining of blood vessels, increases arterial stiffness, worsens cholesterol plaque instability, and increases the workload on the heart, particularly in hot climates where dehydration and electrolyte imbalance further complicate recovery. And one of the most important steps heart patients can take is shifting from packaged foods to fresh, home-cooked meals using natural herbs, spices, lemon, garlic, ginger, and vinegar for flavor instead of salt, while being mindful that restaurant food, even when it tastes mild, often contains extremely high sodium levels, and patients recovering from heart surgery must understand that salt not only affects the heart but also worsens wound swelling, delays healing, increases leg edema after vein harvesting, and can contribute to nighttime breathlessness and sleep disturbance, which is why controlling salt intake is not about deprivation but about protecting the heart's long-term function, improving energy levels, reducing medication dependence, and preventing repeat hospital admissions. And when patients reduce hidden salt consistently, many experience improved blood pressure control, reduced swelling, better breathing, and overall improved quality of life within weeks, making salt awareness one of the simplest yet most powerful tools for heart protection. And my message to every patient is clear: do not be misled by marketing labels, trust your understanding, read labels carefully, choose fresh foods, and remember that when it comes to salt and heart health, what you don't see can hurt you the most. But with awareness and smart choices, you can significantly reduce risk and give your heart the best possible chance to heal and thrive.